Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? It's Dr. Chris here, and today I want to talk about peripheral neuropathy and B12 deficiency because there can be some overlap here. So, B12 deficiency is super common. We'll get into that later. But first, let's go over neuropathy. Neuropathy is a term that I hear kind of thrown around a lot. So sometimes people will say neuropathy, they mean sciatica or radiculopathy. So if you're having nerve pain that's starting from your back and radiates down, that's radiculopathy. But if you have nerve issues, nerve pain, it could be tingling, numbness, things like that. It's usually in a stocking glove pattern, so kind of from the feet or hands working its way up. That's neuropathy. So as it progresses, it can lead to loss of sensation, which can turn into balance problems. And by the way, something that kind of gets overlooked a lot is part of your balance is your proprioception, which comes from your joints. These are your nerve receptors in your joints. So if you've had hip replacement, knee replacement, ankle surgery, if there's any sort of insult to the proprioceptors in your joints, that can also contribute to balance issues. So if you've got neuropathy, and if you've got bilateral knee replacement, hip replacement, your balance could be very affected. But there's other things that can contribute to neuropathy, such as diabetes, smoking, peripheral artery disease, alcoholism, and viral infections. But one underappreciated cause is B12 deficiency. Well, I would say it kind of mimics neuropathy. But the good news is that's pretty treatable. So B12, it's also known as cobalamin. It's a water-soluble vitamin, which means that you don't really overdose on it. And it plays a huge role in nerve function. It helps myelinate the nerves. The myelin is the sheath around the nerve that protects the nerve and helps the nerve signal travel faster. So if that myelin has eroded away, then the nerve signal travels slower and you get motor weakness or loss of sensation. It's also heavily involved in red blood cell production, and you can have B12 anemia, by the way, and in DNA synthesis and brain health. B12 is part of the methylation cycle, which is basically something that occurs like billions of times a day in your body. It's a very complicated process, but it does combine with methylmalonic acid and homocysteine. So basically, if homocysteine or MMA are elevated, that could indicate that B12 is deficient because the B12 might be limiting the rate at which it can produce the molecules it needs to in methylation. So how common is it? Well, 40% of Americans have low to normal B12 levels, and 40% of people over 60 are B12 deficient. And that, again, mimics the symptoms of diseases that are commonly associated with aging, like Alzheimer's, dementia, cognitive disorders, MS, Parkinson's, other neurologic problems, mental illnesses such as depression, anxiety, and cardiovascular disease, cancer, and low libido even. And what we have set for our normal ranges, at least in the United States, may be too low. So our levels are between 200 and 350. It's higher in other countries, such as some countries in Europe and Japan, where their lower limits are more like 450, and that you see a lot less dementia in those countries. So this may be part of that. All right, now why is that? Why are our B12 levels low here? It can be because of inadequate intake, so that comes down to diet. The thing is that you can only get B12 in animal products. So if you're vegetarian or vegan, you're highly likely to develop B12 deficiency. Now you may have heard that you can get B12 from seaweed and some other plant sources. That's actually not true, unfortunately. There's something called cobamides, which is a B12 analog, which kind of looks like B12, right? Because B12 is cobalamin. And unfortunately, that actually inhibits the uptake of B12. So taking these vegetarian products that claim to have B12 can make it worse for you. So it may be in your best interest to look into supplementation. Because plants don't need B12, they just don't store it. So inadequate intake is one reason. You could have some malabsorption issues due to low stomach acid, or hypochlorhydria it's called, or chronic use of things like PPIs and omeprazole that block acid production, so you don't absorb most of your nutrients. H. pylori or atrophic gastritis can inhibit B12 ingestion or absorption. And there's also something called pernicious anemia, which is an autoimmune condition where the immune system destroys the parietal cells, which produce something called intrinsic factor, which is how we digest or absorb B12 in the body. Also, the elderly, as we get older, we tend to produce less stomach acid, and then you're more likely to have an H. pylori infection as well. And then, of course, the chronic PPI use. This can all be what's causing some of the malabsorption issues. Lastly, the diabetes drug metformin does deplete B12. And I looked into recently some of these new drugs that are being used, the GLP-1 agonists such as semaglutide and tirzepatide. Seems like there's preliminary evidence that this may also contribute to B12, but more on that to come. So let's talk about some symptoms of B12 deficiency. There's actually 4 stages. So in stages 1 and 2, the plasma and cell stores of B12 become depleted. And the only thing you'll really see change here is a blood marker called holotranscobalamin, which we barely even test for in this country. So stages 1 and 2 usually go undiscovered. By stage 3, then your MMA, which is your methylmalonic acid, starts to climb. That could be serum or urine, or your homocysteine will rise as well. And then this is when symptoms typically will set in. So that could be fatigue, weakness, sensations, numbness, or tingling in the hands, legs, or feet. This is where the overlap is with neuropathy. Difficulty walking, anemia, a swollen, inflamed tongue, jaundice, and brain fog. Those are the biggest B12 deficiency symptoms. By stage 4, the clinical signs and symptoms of B12 become evident, and then you can develop macrocytic anemia, and peripheral neuropathy becomes more apparent as well. And at this point, it can become irreversible. And besides the fact that this can become irreversible, it's also very important to track too, because if you do have pernicious anemia, again, that's the autoimmune condition. That's the one that inhibits your absorption because of the parietal cells are being attacked. That's a really important thing to know, because in that scenario, you're going to have to do B12 supplementation for life. In fact, the word pernicious means deadly, because before we knew about pernicious anemia, people would die from it. So, if you are getting some peripheral neuropathy, I'm not saying it's always B12 deficiency. Don't just assume it's you getting older. Get to the root cause, because if it is something as simple as B12 deficiency, that's a quick and easy fix. It could certainly be neuropathy and B12 deficiency playing a role as well. At the end of the day, test, don't guess. If you feel like you need some help with this, please schedule a call. Thank you. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.